Good day. This is Head Talk with Mo. Today I'll be talking about women's reproductive health, and it will be in series for a couple of my talk, and I will appreciate it if you can go along with me. Today I'll be talking about menstrual cycle. What is menstrual cycle? Menstrual cycle is the beginning of your last menses to the beginning of the next menses. Take for instance, you had your menses on the 1st of February, and then the next one comes on the 1st of March. That is your cycle. And this menstrual cycle ranges between 21 days to 35 days. In some women, they have 21 day cycle, some 28 day cycle, some 35 days cycle. There are four phases of this menstrual cycle. There are four phases in this menstrual cycle. We have the menstrual phase, the follicular phase, the ovulatory phase, and the luteal phase. Just like the four seasons of the year, the menstrual phase, which is the first phase, could be likened to the winter season when the leaves on the trees are falling and the ground seems to have gone dormant to replenish itself for spring season. And this is when the uterus sheds its lining. The inside of the uterus gets removed because the uterus has been prepared in readiness for a baby coming when the egg is fertilized. But when the egg does not get fertilized, the uterus now will shed with the unfertilized ovum, and it will be washed out as what we see as the blood as menses. If you could also use the analogy of you expecting a visitor. The visitor has called you. I'll be coming to visit you. I will spend a few days. You have prepared the house. You have prepared a room for the visitors. You have even made food beyond what your immediate family will eat. And all of a sudden, your visitor calls you. I wouldn't be able to make it because of situation beyond my control. How do you feel? You will feel so disappointed because it seems all your efforts has gone through to a waste. And that is what happens in the situation of uterus shedding itself because of lack of fertilized ovum coming to sit down in the uterus. And this phase of menstrual phase lasts between 3 to 7 days. So, some women, they have 4 days menses, some have 5 days or 7 days. And this phase of menstrual cycle impacts women's health. How does it impact us? It could impact us, our whole body, and also it could impact our mental health. During this period, you see some people, because of the low level of estrogen and progesterone, they have mood swings, they have altered sleep pattern, they could have their metabolism will be affected, and there may be skin changes in their body. And because of the release of this shedding of the lining of the uterus, there are some hormone-like substances that get released into the bloodstream also, causing cramps in the uterus. And sometimes you see some women at this period also having diarrhea. How do we care for ourselves as women at this phase of menstrual cycle? We can care for ourselves by making sure, if you are the type that gets the sleep pattern disturbance or you don't sleep well, why don't you take time to have extra sleep? Or if your job schedule allows you to sleep in the afternoon, take a nap in the afternoon. Take advantage of it and nap in the afternoon. And this is a period when you should eat high protein diet and food rich in iron, because when you lose blood, you are losing iron. Make sure that you do light exercises that will help the muscles of your uterus to relax. And you can also get eating pad and apply it to your abdomen to cause a dilation of the blood vessels. It opens up the blood vessels to get into your uterus. And also, if you are the type that you get anxious at this period, you get irritated, you become irritable, why don't you take time to think on things that are good, positive things. Look towards positive things. Thank you for listening, and have a great day.